Experiencing knee pain or that nagging ache in the front of the knee, in this video I'm going to teach you some things that you want to be looking for in order to fix this. What's up guys, my name is Dr. Nick Monforte, physical therapist. So knee pain is super common and it's a frustrating thing, especially if it limits you in your workouts, training, just really getting in the way of the things you like to do. Now, when we're dealing with knee pain, it's the joint in between, obviously the ankle down below and above at the hip. So a lot of times we have to look at these two regions to figure out maybe why you're experiencing the discomfort to the knee. Commonly, when you get too caught up with just looking locally at the knee, you kind of miss the big picture, and that's where a lot of these things can linger around for a long time. So you can't just rub the knee better and just throw some lotion on it. You gotta look at more of a better approach to this at the bigger picture and address some key things. So let's get into them. All right, so before we get into it, there's two ways to look at it, from a strength standpoint and a flexibility or mobility standpoint. In this video, we're gonna just look at it from a mobility standpoint and how it can contribute to some of these issues. No doubt about it, the strength at the hip and the calf contribute to it, yeah. But we're gonna look at just from a flexibility and a mobility standpoint. All right, so starting at the ankle, we have to look at the major limitation that's typically the reason, and that is ankle dorsiflexion, a lack of ankle dorsiflexion. So you can see with this test, the idea with this is in this half kneeling position, keeping the heel down on the ground, you wanna try to get the knee as far forward over the toes. Now the distance can vary. Commonly, it's about 4 to 5 inches. If your heel can stay on the ground and you can hit the object in front of you, whether it's a wall or a leg of a table, you're pretty much okay from an ankle dorsiflexion mobility standpoint. But when it's lacking in this motion, as you can see with this video, then you know that this is a possible contributing factor to maybe the development of some knee issues. So when we lack this range of motion at the ankle, it leads up the chain as some compensations that have to happen, such as maybe twisting, and then that can start to brew up and contribute to some of the pain at the knee. Now looking above, we have to look at the ability for the hip to rotate into external rotation and internal rotation. More often than not, a lack of hip internal rotation can contribute to some of the issues down the chain. Can external rotation play a role? Yeah, but a good way to assess hip internal rotation is by using this test right here. Now, with this one, we're just sitting on the table and moving our leg out into hip internal rotation. The idea is to see if you can get to about a 45-degree angle with the lower leg without any compensations going on at the hip. When you can't get to this range of motion, then you know this could possibly be leading to a contributing factor down the chain at the knee, leading to some of the issues, pain, discomfort they might be having. Now you might be thinking, well, how do I go fixing these types of issues? Let's go over one exercise for a lack of ankle mobility and one exercise for a lack of hip mobility. So this first one up, we're working on the ability for the ankle to move into dorsiflexion. So passively, we're moving into dorsiflexion, driving the knee as far forward over the toes as possible, and then coming back out of it. The idea with this is we're working on the ability to move in and out of this range of motion, and over time, it can start to loosen up this range of motion. Are there other follow-ups that you might have to do to address this? Yeah, but this is a good starting point if you lack this range of motion. So the idea with this one, keeping the heel flat down onto the ground, driving the knee as far forward over the toes, feeling a nice stretch to the lower leg, calf, Achilles complex, coming out and just mobilizing, going in and out of the position. Now with this one for working on hip internal rotation, we're working on an active mobility one. So you can see with this one, I have a yoga block in between my legs, and the idea is I'm trying to get the ankle up to the ceiling as far as I can. That's working on the active ability of the hip moving into hip internal rotation, which will help improve the body's ability to improve hip internal rotation over time with repeated input. So there you go. Hopefully you learned some things throughout this video and gained some more insight that you can't just do some random exercises. You have to scale back some of the pieces and figure out maybe why you're experiencing the pain and assess it. Strength, flexibility. In this video, we just focused on mobility, but also strength can play a role into it. So again, hopefully you learned some things and gained some value out of this. Also guys, I'd really appreciate it to really help out with the YouTube algorithm if you subscribe, like, comment, leave any questions, turn on your post notifications so you never miss a video. It would really help me out, and I truly do appreciate it. Also, if you want to learn about things that I could potentially help you with, some of the programs I have, and some of the free guides that I have right on my website, then check it out. I'll leave the link somewhere in this video, down below in the description. Head right over to the website, learn more about some of the programs that I have on there and how they can be beneficial for you, and also just pick up a free guide. It's free, why not? This is Dr. Nick. I'll see you next time.